Hey up people, hope you're all doing peachy. I'm not doing too bad. And for those who go to the gym, a lot of you would like to look big. You like to bulk up them muscles. You want to pump up the iron. You want to turn them muscles into stone cold hard iron. Yeah. Anyway, sorry. But yeah, we want to look big, don't we? We want to look good. We want to be healthy. We want to be strong and fit. We want to prolong a life and things like that. And there's so many ways we can do it. Um, I've already done a video talking about muscle hypertrophy, which I recommend going watching. And because I've mentioned two protocols in there that we can develop muscle growth. One for a traditional method. We go to a gym, pick up a weight, approximately between 50 to 75% of our one rep max. We lift for, say, 12 repetitions max. We rest for about 30 seconds to about a minute and a half. And then we rinse and repeat again for another 3 to 5 sets, give or take, approximately. Six sets total. And got a phone. And another way is that we can use light load. We can use resistance bands as well on top of it. Light load. We just keep pumping the muscles until we feel completely fatigued. We completely drop. We rest for about 30 seconds, again for another minute and a half, 90 seconds, and we can just rinse and repeat the same protocol again. The only thing is that we use a lot of load, high repetitions. And there's another method that we can do, which I've deliberately not done in that video because I want to talk about a separate video because it's own thing. It has its own contributions to other things, if that makes sense. So this one's going to be about blood flow restriction. Some of you might have heard of blood flow restriction training. It's been used for rehabilitation. It's been used for muscle growth, muscle development, strength development, and it's been widely used. So we can use that. The benefits of blood flow restriction is that it does all the things that like traditional training can do. So blood flow restriction training, what it is that we put a cuff on a limb that we're working on. Let's say I want to work on my arms, let's say biceps and delts. I can put a cuff around my arm here between the deltoids and the biceps and triceps. And what we can do there is we can add what's called occlusion pressure, and it goes in percentages or millimeters of mercury, and look up with blood pressure. So some beginners, if they're looking to go into this, before we start actually, I strongly recommend going and see a medical professional before you go and do any blood flow restriction training, because there are contraindications as to why you shouldn't do it. One example could be lymphedema. You've had lymph nodes removed. You've got cardiovascular disease. Anything. You could have respiratory problems. Things like that. And that's not an exhaustive list, by the way. Just to let you know, there are factors why you shouldn't do blood flow restriction. That's why I strongly suggest you go and see a medical professional, GP. Go and talk to a physiotherapist or sports therapist. Speak to a strength conditioning coach as well if you can find one. Get them to talk to you about blood flow restriction. And yeah, see a medical professional just to see if it's safe for you to do BFR training. Okay, I just thought I'd put that out there. So BFR, as it says in the name, restricts blood flow, but it doesn't completely restrict it. It restricts, or the best way I can put it is that it reduces the flow of it. So let's say, for example, if I did put a cuff on my arm here, what that's doing is constricting the blood vessels quite narrowly. And when a blood vessel restricts, it causes what's known as hypotension. So it's blood flow, it's been reduced, low blood pressure. And what that does is that when we have an injury, for example, let's say I've injured my shoulder, blood will start rushing to it immediately. When we lift in weights, we've already started to tear the muscles because it's really an injury when we tear the muscles. When we lift weights, it is an injury. That's why we get the DOMS, delayed onset muscle soreness. And additionally, well, what's happening is that when the blood flows to the area, when there's no constriction, we're working up a sweat, thermodynamics increase, our body temperature increases, in other words. The blood vessels increases, veins and arteries increases. Therefore, the arteries, the blood would heal the area immediately, although it's not an instant healing process. Obviously, we just torn the muscles. It's going to take time for it to repair. Damage is quicker to do than what repair is. So it starts healing quickly. But what happens when we put a restriction around that blood and we lift lighter loads, so that we're still causing muscle tear at the same rate that we would do with a traditional method? The only thing is that now blood is restricted or moving slowly around the area of where we're working. Therefore, the healing process has plummeted quite significantly, depending on how much occlusion pressure you put on that limb. So if I was to put on 80% of occlusion pressure around my arm here, and I started doing night loads, that then is going to obviously trigger the immune response, but also the blood flow is not going to be able to get to it to heal it properly. And that's where the effect of blood flow restriction comes in. We can't restrict him the process of the healing, so we can get more benefit when we lift the loads. And if the next time you go to the gym, if you did one day of traditional methods and then the next day you do a blood flow restriction, if you did, let's say, 75% of your 1 rep max, traditionally, you did 8 repetitions to 12 repetitions, 4 sets, we'll keep it at 4 sets, and then the next day, rest period, you rested about 90 seconds, 60 to 90 seconds. And then the next day, you did blood flow restriction training. You did, let's say, your occlusion pressure is, let's go with 70% for now, 60 to 70%. If you do that, you lift the load to approximately 20% of your 1 rep max. So you do that, and the protocol remains the same: 60 to 90 seconds rest, not minutes, seconds, and 4 sets. If you compare them two together, you will notice similarities to it. However, they found that traditional methods you can still use, so you can still perform your overall reps within your sets. However, with BFR, if you did 30 repetitions, for example, on your first set, and then for some reason you drop down to 15 or 20 repetitions, and then 15, you're dropping down, it's because the blood is not going there to facilitate the healing. And remember, we got the pathways of energy replenishment, haven't we? Glycolysis, acidosis, and the oxidative system and glucosis. So we've got those 3 systems that goes through. With traditional, it's more efficient. However, with BFR, it's been starved and the body's screaming, the limbs going like, where the is my fucking nutrients, you baskets? It's screaming for dear life because it's not getting enough or as much macro and micronutrients it needs to facilitate the healing. Again, we've got ATP, adenosine triphosphate phosphocreatine. That's still being replenished. However, the tissues are still being damaged. So therefore, the amount of blood flow being lost, therefore no nutrients going to it, significantly makes more of a higher metabolic demand, therefore causing higher stress. Excuse me. And therefore more muscle tears. So if you've done that for a day and then you try to do it the next day, you do it for say 4 days, again 20% run at max, you notice some significant pain and DOMS in that area compared to what you're doing it traditionally. So you should give it a go. Again, consult a medical professional first. And that's how blood flow restriction works. I want to look at a systematic review. Get up to it. The effect of blood. I really can't speak today, guys. Sorry. The effects of blood flow restriction in patients undergoing knee surgery. Okay, Longstrangulatelle. Okay, it's a systematic review and meta-analysis. Okay. Okay, that's a little bit. Atrophy of the cross more is okay. Let's see if we can find a little info about BFR, because that's what this video is about. But yep, that's the thing, guys. I just want to read this part here. To combat the challenges of muscle atrophy for patients undergoing knee surgery, blood flow restriction training has been shown to have beneficial effects. Let me just scroll this down to, let's scroll it down for there for now. I like that. Okay. To combat muscle atrophy for patients undergoing knee surgery. BFR training has been shown, I've lost myself, for persons using BFR therapy in false applications of extremity tourniquet to occlude, hence the occlusion pressure, venous outflow and restrictive arterial inflow. Force, anaerobic environment is created. Again, and higher anaerobic means a higher metabolic demand. Okay, a higher anaerobic environment, therefore a higher metabolic environment. There we go. Get in the end. It's created to promote muscle hypertrophy by upregulating cell signaling, protein synthesis, and ultimately myogenic proliferation. So what they're saying is that when you go through surgery, you can't really move much because you've been cut open. The immune system's been responded to get rid of the dead cells and all that mitosis. So what's happening with BFR is promoting the cell signaling. So what they're saying, it's encouraging the cells to say that area is not getting enough flow. It's been damaged. We need to repair it immediately. Let's fucking start reconstructing that basket right now. That's practically what they're saying. The use of BFR load resistance training during lower extremity rehabilitation has shown similar hypertrophic effects compared with isolated high load resistance training. So basically, the low load with BFR is practically saying, they're saying that the low load with BFR is similarly effective as with traditional methods using high intensity for short periods. So if it's ideal for patients who are initially unable to perform high intensity exercises. So if you can't do high intensity exercises because of the surgery, using low load, using BFR will provide that effect for you. Even though it's not the same, it provides that very, very similar effect, if that makes sense. And that's why they use it in rehabilitation. And it doesn't necessarily have to be with reconstructive surgery. It can be with a myofibrillar tear as well, a ligament tear, tendon tear. I have lost myself. However, constantly investigate the effectiveness of surgery performed, the timing of BFR implementation, and the exercise performed. Okay, so you conducted a systematic review to compare it all. So let's have a look down. They've used 11 studies on this. Okay. Taking consideration of the bias table here, they're saying somewhat good level of evidence, less bias to help with participation and participants grouping. That's the word. What's it? Blinding of participants and personal. So how they've done it, blinding of outcomes. Okay. So there's quite a few biases that we have here. Fairly decent, kind of average on the bias levels and all that. And I'll conclude that anyway later on. Okay, so they use different occlusion pressures. I like this one actually. Some from let's start off with this one, fairly recent, 2020, by Cohen et al. Post-op BFR in patients with an ACL reconstruction. Okay. ACL. It's going to be quite a lot of ACLs actually, because it's a common injury that occurs, especially in sports. All randomized. That was partially randomized, probably what the bias level. 2 sessions a week, throughout 8 weeks total, till beginning at post-operative for 10 weeks. Okay. So they've used the Belfit Easy Fit tourniquet cuff using 80% occlusion pressure. So that's just basically the brand name of that cuff, basically. Quite a few of them have used the same tourniquet. Okay. 80% of occlusion pressure, low occlusion pressure, low limb occlusion pressure. That's what that LOP is, limb occlusion pressure, 80%. So that tightness of the tourniquet has been at 80%. And there's a lot of debate on what is 80%, what is 70%, what is 60%, what is 50% of occlusion pressure. I think there's some debate on that, how it feels and things like that. And you know kind of yourself how you feel when it's applied onto you directly. Primary outcome variables, quadricep muscle strength, isokinetic. What's it? Better some muscle volumes, such as knockdown, perceived knee and muscle pain, perceived sensation, blah blah. Yeah, okay. So the majority of them used 80%. However, Iverson et al. 2016, they've changed the way they've mentioned the occlusion pressure. They went from 130 to 180 millimeters of mercury. Additionally, they added the cuff size, which was 130 centimeters wide. I'm on about 14 centimeters wide. Oh my god, you dumb nut. The cuff size measured 14 centimeters in width. So the others have not, and that can play a significant difference, because 14 centimeters, have they used 13, 12, 11 centimeters, 10 centimeters? Because if you had one that's a little smaller, that one, and you think that you've put 80%, that smaller band could actually add more occlusion pressure on without you realizing it. That makes sense. And their tourniquet, that one's, I think, yeah, that one's a new one to me actually. And their tourniquet, if it's what I'm thinking of, it's one of those automatic ones where you download an app for that tourniquet. You put the amount of occlusion on. So, for example, they put in 180 millimeters of mercury on. You put that in the app. You send it, and then the app will send a signal to that cuff, and it was saying that we want that mouth pressure, and it will turn to that pressure. I think that's what that air tourniquet is. Might have a look at that. I'll get a bit more. There we go. A 9 centimeter occlusion cuff, 200 to 260 millimeters mercury. Okay. Unless you're good at converting percentage, these are low limb of occlusion pressure percentages 2 millimeters of mercury, if you know how to convert them together, then you're some mathematical genius, and I want to know how you do that. So guys, just need to check. I've got 10 minutes left on this crappy app. So due to time, I'm just going to rush to the conclusion, and I will put this in the description as well so you can read it for yourselves. Occlusion recommendations. This is the first systematic view to study the BFR in patients undergoing knee surgery. The results in this analysis shows that BFR in the postoperative period after knee surgery can improve quadricep muscle bulk compared with control groups. However, future research should examine the effects of preconditioning with BFR before surgery while implementing a protocol with increased duration and frequency. Additionally, BFR protocols need to be further investigated to determine which provides the best patient outcome. So, very quickly, let's go back up and let's see if they mentioned any load for the research. Fine, it's going down no more. Okay, so I cannot see anything that states load. Let's see if I can find it actually. Control F. Load. I could be overlooking it. Let's look at loading. Okay. Nope. That's load. Let's have a quick look see. Nope. Okay. The apparent load in patients with BFR compared with traditional high load resistant training. Okay. So it's not really specifically saying what percentage of run max that I've been using in that systematic view. I have got another one here. Let's just have a quick look at this one. I'll put this one in, excuse me, in the description so you can see it for yourself. That one's used 11 studies. Wait, tell you what. Control F, load, see what we get. Okay, low load, found BFR under low load. Okay. Not specifically stating how much load they've been putting on. I believe there is a protocol for BFR training, which I will find and I'll put in the description again for everyone to find. Okay. Well, that's BFR, guys. Again, go and see your medical professional if you've got any problems, any conditions that you're concerned about, but you want to try it. See a professional medical assistance first, get some advice, see if it's safe for you to do it, and go from there. But otherwise, BFR, blood flow restriction training, is safe, especially when you're done under supervision and you understand the protocols and positions and all that jazz about it. So I'll link this in the description. I'll find, or try to find, the protocol of blood flow restriction training, because it is fundamental that you know how much load you're lifting before anything like that. Because they say low load, and their low loads could mean something between 30% to 50%, 10% to 60%. Although 60 and 50% of your run rate max is considered moderate. Low load is below, so it's like 40% and below would be light load to very light load. But I recommend going to 20%. You could push it to 30, but just be careful. But yeah, guys, again, medical professional, go and sit them out. And all this will be linked in the description. So I appreciate you watching, guys. I hope you found this informative and educational and amusing, especially for me anyway, my talking. So yeah, guys, that's BFR. And I appreciate you watching, guys. Yeah, leave a comment down below. Please like, subscribe to the channel. I got my gaming one, which I'm doing a video on that. Silent Hill F. I've just done a video on that. I just got to edit it and put it up. And yeah, so again, guys, comments down below. So what do you think of blood flow restriction? Do you do it? Do you not do it? And all that. And what do you think of it? Subscribe to the channel. Share the video. Thanks for watching. Make sure you subscribe to that YouTube and goodness. Thanks for watching.